High-salt diets have been shown to increase water consumption, which results in urine dilution and, consequently, a decreased risk of urolithiasis, or the formation of urinary stones. Many commercial veterinary diets formulated for urolithiasis management incorporate this increased sodium content. However, the question of long-term safety looms large. In humans, high salt intake is linked to increased blood pressure, systemic arterial hypertension, and chronic kidney disease, raising concerns about similar effects in cats. While prior studies have suggested that high-salt diets do not adversely affect cardiovascular or renal health in cats, there is a need for more extended research, especially focusing on healthy aged cats, given the age-related increase in blood pressure and decline in renal function. To address these concerns, a team of researchers embarked on a 5-year prospective, randomized, blinded, and controlled study known as the Peanut Study. This study aimed to evaluate the renal and cardiovascular safety of a high-salt diet when fed to healthy aged cats over a prolonged period. There was no indication in any blood or urinary variables of consistent changes or adverse renal effects resulting from the high-salt diet. The high-salt diet also did not affect kidney perfusion relative to the control diet, as determined by the resistive index for intrarenal blood flow. Systolic blood pressure was not affected by the high-salt diet, and there was no indication of primary hypertensive disease in the test group. The absence of clinically relevant long-term cardiovascular effects of a high-salt diet in healthy aged cats provides further evidence of species differences in physiological responses to high sodium intake. Unlike in humans, the high-salt diet in this study did not induce diffuse or localized hypertrophic changes, left atrial or left ventricular dilatation, systolic dysfunction, or left ventricular outflow tract obstruction. Decreases in interventricular septum thickness at end diastole were observed over time in both groups and may have been related to decreasing body weight. No arrhythmias were detected in the study. The study also indirectly assessed the impact of dietary phosphorus on renal health. The cats in the study had been fed diets containing 1 gram per mcalm of phosphorus in the form of potassium monophosphate and pyrophosphate. The low frequency of azotemia observed during the study suggests that 1 gram per mcal of dietary phosphorus, at least in the form of potassium monophosphate and pyrophosphate, is safe for chronic feeding.